With me today is Dr. Bruce Nosky. He's the Veterinary Services Manager with Merial. Now, of course, Dr. Nosky, we've got a lot of great products here at the NCBA, and Zactran, it's a new product for Merial. Can you tell me a little bit about that product, first of all?
Yeah, it is. We got approval about mid last year, so it's been out on the market for 7 months now. And our first 7 months, we're very pleased with the sales and the results that we've seen, that the producers have seen with using Zactran. And it's an antimicrobial, and it's approved for bovine respiratory disease. It's approved to both treat animals that are sick from bovine respiratory disease, as well as approved for control, which means you're buying cattle, you're arriving cattle, you can treat cattle on arrival. Those that you expect will become sick, you can use Zactran to control respiratory disease or metaphylaxis treatment of cattle.
And of course, respiratory disease, one of the biggest concerns for cattlemen out there. It's here at the convention, we talk all the time about different methods of how to increase their profitability. They keep stressing that a healthy calf or a healthy cow is really the way that you're going to increase your profits.
Absolutely, and that's one of the reasons that producers are using antibiotics on arrival when the cattle come into the feed yard or when they come to the stocker operation, because if you can keep them happy, you know that there's going to be X number or a certain percentage that are going to get sick, and if you can keep them from getting sick, that's the spot where Zactran has been adapted quite nicely in the last several months. Those that do get sick, for first pull treatment, that's another use of Zactran when cattle do get sick.
Tell me about this antibiotic in comparison to other antibiotics. How does it differ?
Probably the two characteristics that make it interesting is the fact that it has, you can see a rapid response. You got sick cattle, you treat them, and studies that we've done have shown a 24-hour, you see clinical improvement. So it gets into the bloodstream rapidly, gets to the lungs rapidly, and it works rapidly, as well as it's got a 10-day duration. So again, when you receive cattle and you treat them, you've got antibiotic working for 10 days. So it's got long duration and rapid response.
Now, of course, cattle producers, they're wanting results, but now they're being put under pressure more than ever as far as antibiotic use in cattle, those kind of things. Is there any differences in this, as you were talking about, the longer lasting and the quick effectiveness of it, but what about the impact on the final product, I guess I should say?
Well, the producer is not going to use an antibiotic up front if it's not going to show results at the end of the day. And so at closeout, if you can keep those animals healthy up front, you always see the benefits at the end of the closeout period.